So for the subcostal four-chamber view, people often call it a subxiphoid view too. The indicator's off towards the left side. Again, this is cardiac imaging, so it's reversed to what we're used to. And my hand is on top of the transducer. You can't really get a good subcostal like this because as you try to flatten your probe out, your hand's going to bang against the patient's abdominal wall. So you really want to put your hand on top of the transducer and get up into the epigastrium and then kind of press the transducer down and aim up into the chest. And when you do that, you'll end up with a nice subcostal four-chamber here where you're able to appreciate the right ventricle, the right atrium, the left ventricle, the left atrium, and the pericardium surrounding the heart. So this is a good subcostal view, really good for evaluating for pericardial effusion down here. And you'd want to fan through the entire pericardium if you were looking for that. You can also go ahead and get a good subcostal two-chamber by rotating the indicator up towards the ceiling, in which case now you've got a view of the left ventricle and the right ventricle, and you've got a short axis view. So in patients where you have a hard time and you're struggling to get a parasternal short, you can get this as a subcostal view. And in this case, as we kind of bring the beam over closer to me, we can see the inferior vena cava right here, entering into the right atrium, and you can get additional information about the vena cava, which we'll cover separately. So going back to the four-chamber, you're in the epigastrium, you're pressing down with the transducer. Sometimes having the patient take a deep breath can help you with your view, although in this case we're seeing a good view, it's probably not that necessary. And then as you lift the transducer up, you'll start to see the vena cava in short and transverse here with the drainage into it from the hepatic veins. So that's vena cava there, and then draining into right atrium, and you've got your four-chamber subcostal view, and again, from here, your two-chamber subcostal with your left ventricle and your right ventricle.